Yes. Well, we officially now have a quota, and so I'll call this meeting the Health and Human Services Committee together. I mean, we can sort of joke, but people are getting lunch. Yay! I hear you're the instigator of serving the Chinese food that kept everybody away from our meeting.
You had lunch yet?
No,
Stop, I get some.
I didn't tell on you.
no.
Mark can't say that.
It was the smell that Mark brought in with him, the Chinese. No, we're teasing. Okay, let's see.
I don't get fatty, gonna have to find it myself.
Okay. Don't get me any more tickled. Okay. Representative Pruitt, if you want to go to the podium, we'll let you go first. And this is for House Bill 1404.
Thank you, Madam Chair.
Okay, and I have that we are working off of LC 339098S. Is that correct?
That's it.
Okay,
Very good. This bill just really just does one thing, and it adds subsection 142.4, which just mandates that the Department of Community Health submit for a waiver to allow with the CMS, the Centers for Medicare and Medicaid Services, to allow for reimbursement for mental health and substance use disorder treatment. Two things there. On the second page there, it just talks a little bit about making sure that they're making use of that, mandates them to use that. But when that happens, this will kind of accomplish two major things. One is that it will allow for reimbursement for the services offered through those IMDs, Institutions for Mental Disease. And then the second thing, it'll open up additional beds for the for mental and substance use disorders.
questions for the representative? So let me bring this to just a little clearer. What it does is that we have private providers of mental health beds services in-house. And sometimes, especially around the rural areas, they have vacancies, which there is now a rule that they cannot accept Medicaid patients. So if we change this and ask for a waiver, they would be allowed, when they have beds available and we need them because we can't find a place to, for somebody that needs in-house medical services, they would be able to provide that.
That's correct. And then those ones that are currently have the emergency room type operations where those people are coming in, they have to accept them anyway. They're not getting paid for those services they're rendering. So it'll close the gap on that as well.
Okay. Has anybody thought of a question? Okay. Is there anybody in the audience? Oh, we have one person, Anna Adams with Georgia Hospital Association. Just for a second.
Thank you, Madam Chair, members of the committee. I just want to, for the record, officially let you know that GHA is very supportive of this measure. On behalf of our members, on behalf of our psych hospitals, we would love to see this pass. So appreciate your favorable consideration.
Thank you. I'm glad to see that the Hospital Association is in favor of something and not opposed to something.
That's my goal this year.
Yeah, and the first thing I got here this morning when I hear it was I going to have a CON bill in my committee today? I couldn't walk 5 feet with getting asked that. So, and I'm going, no, that's not me this time. So anyway, I'm just giving Anna a hard time. Okay. Okay. Yes, right. I'll be there. Okay. Oh, you're going to let the vice chairman do it? Okay. Anyway. All right. You have a question, Representative? Who was that? Oh, did you put it on for that reason? Did you have a question?
I have,
Oh,
I'd like to make a motion at the proper time.
Oh, okay. I'm not seeing anybody else have a question? All right, so I'm ready. If this is the
I
proper
make a
time.
motion to pass.
Do I have a second? Okay, is there any further discussion? All right, anybody online? Looks like we don't have anything. Everyone in favor of the substitute to House Bill 1404, LC 339098S, say aye.
Aye.
Opposed? No. But it looks like the ayes have it. Thank you very
Thank
much
you
for
very
bringing
much.
this. It's a good bill. And I am on this committee that recommended this. And so thank you for helping the rural areas of our state.
Thank you.
So, okay, Representative Hawkins, you are next. And that would be with House Bill 1484.
Can I do it from here?
You sure? Nope. Yeah, you can do it there, wherever you're comfortable.
I'm full of Chinese food.
Oh, you too.
I don't want to get up right now if I don't have to.
Okay, from now on, I'll just go by Representative Kelly's office and I'll pick him up and bring him with me. Who did? Who?
One you just went past the bill, I thought he probably brought you.
Do you have a pie making business, Representative Pruitt? You told me you were an entrepreneur, so I thought maybe that was one of your businesses. So, okay, Representative Hawkins.
Thank you, Madam Chairman. I bring to this committee HB 1484 today. It's LC 339096S. And let me explain the S. The original version of this bill called for a study through Medicaid and also a date of 2023, which was not possible. I've been working with Ryan Loke, Deputy Commissioner of DCH, and under his advice and good thinking, we've moved this to the State Health Benefit Plan because CMS, federal CMS, when you get into a pilot program, you may be looking at 3 years to get an okay from them to do anything. So it speeds this bill up. This committee has heard for years about PANS and PANDA and the discussions and some of the arguments about the diagnosis and those things. I think, after the Journal of Child and Adolescent Psychiatry has made notes of this over and over again, and the study showing that it is a strep infection. And we've seen all the pictures of the kids and heard all the mothers that this is time to do this. I mean, it's time, the time is now. So what this bill does is it calls for a 100-person study and allows a patient advocacy organizations to create outreach for the patients and to bring patients in. And also will standardize some code claims for analysis by the department. And the initial report will be December 31, 2024. So I would ask this committee to really consider this as a starting point. And I think it's time that we do this.
Questions from the committee? Okay. What's your mic?
Thank you, Madam Chair. Is there going to be a cost? How is that going to?
Obviously, we'll have to put it into the budget, and that's the reason line 14 says subject to available funding. One reason I wasn't trying to do it in 23, our budget's down the road now. Hopefully, with the governor's keen interest in mental health, this is right in line with mental health. It is a mental health issue, and hopefully we can get it in his budget next year. And if not, I'll work with Chairman Pierce, see if we can get it in the health appropriation.
Thank you.
We have a question from Representative Bennett online. Representative Bennett.
Thank you, Madam Chair. I have more of a comment and a hand clap. I want to thank Madam Chair for all of the work that she has done in this area and bringing this information to the public. And I want to thank Chairman Hawkins for the great opportunity that he and his team have found to ensure that we can move forward on this, at least the pilot study of 100 persons, so that the number of families that are impacted by this in Georgia can get some type of support and relief. But more so, the pilot project will give us information that is needed to be able to have this condition covered, because it does present at first, it comes on with strep, it does present as a mental health issue. So I'm just so thankful and elated today that we are at this point in our deliberations. Thank you, Madam Chair. Thank you, Mr. Chairman.
Okay. Other questions for the representative? How long did you tell me that this seems to be strep based? If you remember the person that retired from NIH who came and talked to us. And what were you telling me, Representative Hawkins? How many years did it take the medical community?
100 years to associate strep and rheumatic fever.
Okay, 100 years before there was an association of strep and rheumatic fever,
The acceptance.
acceptance of
right.
it. So even though this seems quite unusual, it is more and more people are having children that exhibit what they believe are the symptoms of it. Do we have somebody from CHOA here? Okay. Oh, well, hey, David. David, remember we talked about this? Maybe you can get it for one of our meetings after crossover now, of course. Y'all were having a physician at the time that was going to be treating these patients. He really wasn't, equipped at that time to do a study, but he was going to be available. What's happening on that?
Thank you. You are correct. Your study committee that was 2 or 3 years ago, Dr. Gadella, who was our new head of neurology at that time, spoke. And at that time, he was looking into putting together a pilot clinic to look at this because at that time, the literature was still back and forth on whether this was legitimate, for lack of a better term. But since then, it appears that it is. Then COVID hit, it discombobulated everything with us. And we've been back in touch with Dr. Gadella, and they're looking at the workforce needs to do something right now. I know
Okay.
there's a meeting in less than 30 days to talk about it. And our issue is we don't have a lot of pediatric neurologists. They're a rare commodity, and we've got a pretty big waiting list right now. And to be able to fit this into that waiting list, we'll have to see what we can do.
Okay. Is it worth having him come and talk to us again, or do you think it's too early to,
Maybe too early.
for him to,
I
because
think
of
that,
COVID?
but I think what you're, because I don't think we've come to a conclusion and what our needs are going to be, but what this is, a good, as you put it, is a good first step.
Thank you very much for that information. So, okay. How does have a do pass? I have a motion to pass and a second. Is there any further discussion?
Second.
Okay, thank you. Seeing no further discussion, everybody in favor of the substitute to House Bill 1484, say aye.
Aye.
Anyone opposed? No. Okay, the ayes have it. This is the last meeting, hopefully, before we have crossover, but you never know if it is going to be the last. So be on standby in case you get a email saying that we do have to meet for some reason or the other. Thank you very much for the service so far this session. And